Growing up in a tiny town was kind of rough on me. I had this undiagnosed genetic disorder, and also, I was gender non-conforming, and we were like the only Jewish family in town, and my parents were vegetarian hippies, and let's say there was like a lot, there was a lot for bullies to work with there. And it was the 80s. We weren't really talking about bullying in schools the same way that we are now. So, a lot so they tell me like, oh, they're picking on you because they can see they're getting to you. So I took that to mean like, hide weakness at all cost.
Hey there, and welcome to In Sickness and in Health, a podcast about chronic illness, disability, medical traumas, and everyday uncomfortable healthcare experiences. My name is Kara Gale. I'm not a doctor or a medical professional. I'm just a person and a patient who really wants to talk about this stuff more. Nothing on this podcast or any of its related content should ever be considered medical advice. I want to be very clear about that. If you're experiencing a medical issue, please seek qualified and timely medical help. I know the system sucks. I've been there, but I wish you a lot of luck. We're all going through this together, but I can't stress enough how different we all are, even if we were to have identical medical files. There are so many factors that go into shaping a person's experience of health and illness. Just because something worked for one person does not mean it will work for you or anyone else. I want to ask my audience to remain respectful of the very personal decisions of my guests, and remember that the choices of others do not reflect or affect any choices of your own. But Rebecca and I have an awful lot in common. We both grew up weirdos in the same tiny mountain town in northern New Jersey, attended the same high school at different times, have many of the same diagnoses, and even saw the same doctor at one point long after we had both moved away from home. We had so much to talk about, I had to split our interview into 2 separate episodes. Next week, I'll be posting part 2, where we talk about Rebecca's advocacy work toward accessible transportation in Philadelphia, some of the social and economic issues facing the chronically ill and people with disabilities, reconceptualizing disability, internalized ableism, and diversity of disability.
So even though I was like sick frequently, and would be missing school, like I definitely, got in the habit of reducing my own dislocations. And, I got very adept at wrapping my sprained ankles with ace bandages on my own. Also just because, the doctors that I saw weren't particularly helpful either.
Mm.
Like there was, by the time I was hitting puberty, it was pretty clear that there was something wrong with me, but they didn't know what it was.
Right.
So eventually, like, I just stopped going to the doctors because I assumed that they couldn't help me. And they really couldn't at that point. I would need a diagnosis for that to happen. A good, like, kind of culminating point was when I think I was 10 or 11, and I was homesick with the flu for the, zillionth time that year. Um, and keep in mind that I wasn't diagnosed with Ehlers-Danlos syndrome until I was 28. So for a long time, it was just kind of mysterious. But I was homesick with my parents, and I asked them, "Mom, Dad, am I a sickly child?" Because I'd read a lot of Victorian children's literature.
Yeah.
And they were like, no, you're not. But that was a lie too. So
Right.
I think that there was just like a lot of denial, a lot of kind of like, filtering my experiences through the very limited portrayals of chronic illness that I saw in children's literature. And I mean, you really didn't want to be like Colin from The Secret Garden.
That was exactly who I was thinking about.
Yeah, you didn't want to be him, but I was really afraid I was him.
Aw. Rebecca now lives in Philadelphia with their spouse, 3 cats, and a dog. While not yelling about ableism, they enjoy container gardening. In today's episode, Rebecca talks about the ups and downs of EDS, their long and winding diagnostic process, working 10 times as hard to be half as healthy as everyone else, and redefining their value while not being able to work at a paying job. This is the third episode in a series of interviews with dysautonomia patients for the last week of Dysautonomia Awareness Month. We're putting up new episodes every day, so keep an eye on your podcast feed or find us at insicknesspod.com. If you want to learn more about dysautonomia, go back to episode 1, Dysauto Whata? Lauren Stiles, the president of the nonprofit group Dysautonomia International, gives us a crash course on just what dysautonomia is. We also talk about the diagnostic delay that many patients face and some of the research her organization has been able to fund. The second episode in this series is with Ilana, a writer and patient advocate who talks about failing alternative medicine, how she manages her career, blogging, the horrors of GI testing, crying in parking lots, and attempting wedding planning while living with a very unpredictable chronic illness. Later in the week, we'll have 2 more episodes with other dysautonomia patients that have different primary diagnoses. Like myself, Rebecca's primary diagnosis is Ehlers-Danlos syndrome. Sometimes it's pronounced Ehlers, sometimes it's pronounced Ehlers, sometimes it's pronounced Ehlers. The pronunciation isn't really important. It's not something that a lot of people have even heard of. It's barely taught in medical schools, and most doctors know almost nothing about it. It's complicated and poorly understood, but I asked Rebecca to explain a bit about the condition to give you an idea of the basics.
So Ehlers-Danlos syndrome is a group of genetic disorders of connective tissue formation and metabolism. Usually it's collagen for us, definitely for the most common types, which are hypermobility and the classical variation. So in most cases, it's going to show itself with dislocating unstable joints, either like complete dislocations or partial dislocations, which are called subluxations. So we have a lot of, we can have muscle spasms, which is the body's way of compensating for those instabilities. And we also are very prone to injury. So whether it's like small repeated micro tears in the muscle or in tendons and ligaments, or if it's, tendinitis or like actual, complete tears, sprains, strains, all kinds of fun injuries. And so I guess it probably goes without saying that can cause all kinds of chronic pain and also kind of progressive disability. Most people with Ehlers-Danlos syndrome also show some disorder of the autonomic nervous system, which is called dysautonomia. And one of the more common types of that is POTS, postural orthostatic tachycardia syndrome. So that means that when you are changing position, like to get upright, to stand up, your blood tends to pool either in the abdomen or in the legs and feet, which causes tachycardia as a response, and sometimes syncope, which isn't, fancy medical way of saying passing out. It can be very disabling. It can also come with all sorts of gastrointestinal problems, like gastroparesis, which is delayed gastric emptying, or no gastric emptying in really severe cases. And food allergies are really common. And these are all things I struggle with. It's really an adventure.
Our bodies are a wonderland.
Truly. And I didn't even get into the immune derangement or, what happens to your cervical spine and brain over time, causing all kinds of kind of secondary neurological complications.
We talk more about EDS and its effects in this episode and in next week's as well. I hope you enjoy the interview. We had a lot of fun recording it.
So it was kind of an interesting mix of approaches. So like I mentioned, we were vegetarian and kind of crunchy, and my mom ran a food co-op out of our garage, and was like a natural childbirth instructor. So, so we went to the health food store, and, my immune system was awful. So we'd take, echinacea and golden seal, and my stomach was always hurting. So that was papaya enzymes. But at the same time, she also took me to the doctor. So it wasn't like they were depending entirely on these, kind of natural remedies,
Right.
or non-remedies, as the case may be. So it was definitely like kind of a comprehensive approach. But my parents really trusted the doctors. So when the doctors said like, they're okay, there's nothing wrong with them, my parents, believed them, which was, kind of reasonable, I guess. We're trained to kind of respect authority and, believe doctors and respect their credentials.
Right.
But that might not work when you have a rare disease.
Yeah. What have you been diagnosed with, and what exactly does that mean for you?
Okay, so the genetic disorder that I've been referring to is Ehlers-Danlos syndrome. Most probably the classical subtype, though possibly the hypermobility subtype, and it'll probably all be changed next summer anyway, so I'm not too caught up on the specifics.
Right, because they're doing an international symposium where they're planning to rewrite the diagnostic criteria and probably
Yeah,
redo the typing of them
we'll
all.
all get reshuffled probably.
Right.
It's actually a good thing.
Oh, I'm super psyched about it.
Yeah, we're way overdue. 1998 or 97, I think, was the last round, right?
Yeah.
So anyway, so along with Ehlers-Danlos syndrome, I also have postural orthostatic tachycardia syndrome, gastroparesis, mast cell activation syndrome. I think those are the big ones.
Yeah.
And I have generalized anxiety disorder and post-traumatic stress disorder.
Oh, that's a fun combo.
Yeah, totally. And I mean, I've had anxiety disorders in the past that I don't seem to have anymore. Like, I seem to have outgrew my obsessive compulsive disorder, which is great. Like, I'll take it. I have enough already.
Yeah.
And let me think what else. Yeah, and then there's like, just all the like really secondary stuff like, temporomandibular joint disorder and tinnitus and cervical myelopathy and cervical radiculopathy and, many, many herniated discs. And I think I have a tear in my right shoulder right now. I'm going for an MRI on Wednesday. But like, that's life with Ehlers-Danlos syndrome.
Right.
Like, it's kind of, one thing after another. Like, you triage the most urgent problem and just kind of like live with the rest in the meantime.
I always say it's like playing whack-a-mole.
Yes.
Like every time I address one issue, I'm like, oh, sweet. Wait a minute, what's this other thing that's been here this whole time?
Yeah, and like, the things that like other people think are the biggest issues aren't like really. So, I mean, to be very blunt here, I used to have like diarrhea all day, every day.
Oh, please talk as much about diarrhea as you want. If I could do a poop cast, I would.
I will be a guest on your poop cast.
Yes.
I have much to say about poop. So getting to the point where I wasn't waking up at like, between 3 and 5 a.m. every morning and crapping my brains out was like seriously like the biggest improvement in quality of life that I like ever experienced. It's those little things. Someone might have thought it was my patellar maltracking, because that was, very painful and very obvious. No, it was the pooping. Yeah. It was the pooping.
Yeah, I mean, being woken up out of your slumber to have diarrhea is not my idea of a good time.
No, you don't want to start your day that way.
No, definitely not.
Yeah, but and really just like getting my body kind of to the point where I could like leave my house again and like show up to things on like a semi-reliable basis has been huge. Like Ehlers-Danlos syndrome has just been a lot of like ups and downs with me. And I'm like pretty clear on the fact that like, we're going downhill.
Mm-hmm.
But it'll be like something major happens and then I get treated and I get a bit better, but not totally better. And then something else happens and I get treatment and I get a bit better, but not totally better. Right. So I'm just kind of like accumulating like diagnoses over the years. But there was like a point where I wasn't able, when I developed symptoms of postural orthostatic tachycardia syndrome, or I should say it got a lot worse, like very suddenly. Mm-hmm. And that was super hard to learn to cope with.
Yeah.
And that's what actually got me out of normal employment because I couldn't get off my couch for a while.
Yeah.
And just, finding the right meds, finding the right assistive devices was huge. And, also just learning to pace myself and, know that if I need to be somewhere, on Wednesday, it means I need to like not do anything like starting on Sunday.
Yeah. Yeah, it's a learning curve for sure.
Yeah. And, I think like we really become experts in self-management.
Yeah.
And I'd like to see, more respect for that and
Mm-hmm.
more studying that coming from the medical field. Like, I think that if they listen to patients more,
What a concept.
maybe that would be helpful. The literature wouldn't be, like in the case of Ehlers-Danlos syndrome, the literature always seems to be at least like 5 years behind
Right.
what patients know.
Right. And as far as doctors are concerned, they get one, maybe two slides on it in medical school that's like, okay, so here's Ehlers-Danlos syndrome. These are all the types. Here's some symptoms that are associated with it. And it just groups them all together. And
Yup.
then they move on to something else, So I hear constantly from other people who are kind of exploring the diagnosis. My doctor told me that I couldn't possibly have EDS because my skin isn't stretchy enough. Yeah.
Verbatim from different people with different doctors.
Oh, yeah, because doctors learn in
classic.
medical school, like Ehlers-Danlos syndrome equals extremely stretchy skin. And that's the thing that sticks out in their mind, and that's what they remember. So when a patient presents with what actually are the symptoms of Ehlers-Danlos syndrome, which I'm not saying that stretchy skin isn't, obviously it is specifically associated with the classical type. But, most of us have the hypermobile type. So if they're presenting with all of the other symptoms and you tell them they can't possibly have it because they don't have stretchy skin, it's such a disservice because then that sends that person back out into the world still wondering what the hell is wrong with me.
Yeah. I mean, I think also like there's a tendency for, whoever picks the photos that go in medical
Oh, yeah.
textbooks, like let's find the most extreme case,
Exactly.
And this is a spectrum disorder. Like
Mm-hmm.
some of us are mildly hypermobile, some of us are extremely hypermobile. But like actually hypermobility doesn't necessarily have anything to do with the severity of the complications you're going to
Right.
experience. Like, I mean, it does for joints, but someone whose joints are only, very mildly hypermobile could still have, one of the associated problems like, Chiari malformation
Right.
or, an aortic aneurysm.
Or even POTS, which can be extremely disabling.
Yeah. And I heard from a POTS doctor, he had, or, nominally a POTS expert who I saw when I was initially, diagnosed with POTS because the people who diagnosed me couldn't tell me anything about treating it because they didn't know anything about treating it. So I went to this guy and, I rode like, several hours in the car, which was very uncomfortable, and then waited a really long time in his waiting room, which was also really uncomfortable. So anyway, what this, supposed POTS expert, does is he comes in and he starts, trying to evaluate me for hypermobility. But, and I'm like, well, I'd prefer not to hyperextend my joints. My other doctors have told me not to. The only reason you'd be doing, I figured the only reason you'd be doing it would be if he, like, actually was doubting the validity of my EDS diagnosis.
Mm-hmm.
But so anyway, I'm like, why are you doing this? And he's like, well, something about severity of hypermobility correlates with severity of POTS.
That's not true.
No, that's not. That's definitely not true. And if, like, these are the doctors who are, presenting themselves as the expert in the condition, I'm really, really worried about.
Yeah. I hear that a lot from a lot of people who are seeing quote unquote experts who are clearly not.
Like, who said you were an expert? You?
Yeah. So you actually got diagnosed with POTS after your EDS diagnosis. Mine was the opposite. I got diagnosed with EDS after getting diagnosed with POTS and being like, why do I have this thing?
Yup.
So can you tell me a little bit about your diagnostic process and how that unfolded?
Oh my goodness. Yes, I would love to tell you about my diagnostic process. So basically, let's say I'm not very good at sports, but I'm really stubborn, which has actually served me really well as a person with a chronic illness.
Yeah.
So I was really stubborn, and I decided I was going to be a runner. So, I ran and ran, and I actually got pretty good at it, through stubbornness. Like, I'm not very fast, but my endurance was good. And I was really good at ignoring like the searing pains in my bones every time my foot hit the ground. So I had like a running accident, which in retrospect was probably a sacroiliac dislocation
Mm-hmm.
that compressed my sciatic nerve.
Yeah.
So it was most likely like a sacroiliac dislocation resulting in sciatic nerve compression, but of course we didn't really know that at the time because no one expects you to dislocate your sacroiliac joint.
Right.
So I went for this run, and something didn't feel right, so I cut it short and I went home. And as the day, I tried to stretch it out, but as the day went on, it got to the point where I literally couldn't sit down without like terrible excruciating pain. So it was on a holiday weekend. The next Monday I went to see the doctor. I was treated with NSAIDs, which it later turned out I was allergic to.
Oh, good.
And muscle relaxants, which it later turned out were really bad for me because they, without my muscles holding my joints in place, the joints don't really have anything holding them in place.
Mm-hmm.
So anyway, like I basically did not get better over the next 6 weeks like they expected me to. So they sent me to physical therapy. And I also had an MRI that showed herniated discs, but none that could actually correspond to the problems I was having. Of course. So, eventually I got in to see a physical therapist. And during the initial evaluation, she said, wow, you're really hypermobile in some areas. And your muscles are hypotonic in some places, but hypertonic in others. So I go home and I don't know what any of these words mean, so I look it up on the computer. And, I look up hypermobility and it says, usually benign. However, if you also have all these other problems that you have, it could be a sign of a hereditary connective tissue disorder, such as Ehlers-Danlos syndrome. And at that point, the light really went off for me. Because I'd been, really dealing with a lot of like health challenges and like just general fatigue and, feeling yucky and irritable bowel syndrome stuff for a really long time. And, I tried to like self-treat with, ridiculous diet and excessive exercise, which, kind of got me part of the way there. But I felt like I was working like, 10 times as hard to be half as healthy as your average person.
Yeah, I went through the exact same thing.
I wonder how many of us do.
Right? Like maybe if I just eat this really, really restrictive diet and exercise constantly, I'll be okay.
Yeah, definitely. Because it's all our fault.
Right.
Like, and if you do gain weight, they'll blame any pain on the weight gain. Like, oh, you should lose weight. But I'm gaining weight because I'm on Lyrica for my pain and it causes weight gain. So I'm one of like the dreaded people who like diagnosed myself off the internet. But in my case, I was 100% correct.
And a lot of times people are. I mean, if you have the skills to be able to evaluate information and verify information, like diagnosing yourself is not necessarily a bad thing. I have done that with just about every correct diagnosis that I have. And it's not like I just diagnosed myself and started self-treating. I diagnosed myself and then brought it to a doctor who was then able to verify that diagnosis.
Oh yeah, same here. I definitely don't recommend like, treating yourself based on your own diagnosis. But like, doctors don't necessarily have these rare things on their mind.
Right.
Or but for me it was just like so like beautifully specific. It was talking about like a narrow palate, and I had to have a palate expander when I was a kid. And the scars, which I was just, covered in. And, and I'd felt like really, really self-conscious of my scars for so much of my life because, they're stretch marks. I was like, oh, it's because I'm fat. I have these terrible stretch marks. No, I have Ehlers-Danlos syndrome. So it's, it was just very weird to kind of, type in a word to Google and like see a description of the rare
Right.
genetic disorder that you have.
It's like stepping into the like back of the closet and entering Narnia.
Yeah, totally. And one thing I did do was I very quickly got involved in the online patient community.
Mm-hmm.
Um, and they were very helpful and encouraging during that initial quest to get a diagnosis. And I definitely saw some people who could not help me during
Right.
that time. But with the help of like all these other people who'd gone through this ridiculous process, I was, they helped me keep my spirits up. And and there was always this fear in the back of my head that, I was being a hypochondriac and I didn't
Mm-hmm.
actually have this. Um, Especially because, some of the doctors I saw, trying to find out if I had it, really, didn't seem particularly impressed.
Right.
But, but no, I mean, I really do have Ehlers-Danlos syndrome. And then being involved in the online patient community was great because, I knew what was happening when I suddenly fell apart because of POTS.
Right.
Like, I knew the symptoms of POTS.
I'm going
Yeah.
through that right now, like with gastroparesis. I've had minor symptoms of it for several years, and I just had a stomach virus earlier this month, and afterwards I'm like, oh, this is gastroparesis. I know exactly what's happening, and it's miserable.
Yup.
Yeah.
Yeah, and I think you also have mast cell activation syndrome.
Yeah.
And that's just one that like I've really like had symptoms of that since I was a kid.
Mm-hmm.
And that I just attributed to general sickliness.
Right.
But that was really kind of it's still a very like cutting edge diagnosis.
Right.
Still like finding acceptance, but it was all over the Ehlers-Danlos syndrome message boards several years ago.
Mm-hmm.
So it was actually really pretty easy to identify that was what was driving like a huge portion of my symptoms that weren't necessarily like this bone's out and this nerve is squished.
Right.
Like, yeah.
Yeah, there's
Getting
just so
treated.
much tertiary weird stuff that happens.
Yeah. By the way, getting treated for mast cell activation syndrome was what saved me from the 3 a.m. poop emergency.
Yeah, me too. I mean, I wasn't having 3 a.m. poop emergencies. I was just having poop emergencies at random times throughout the day. But
Yep. Yeah, so huge improvement in quality of life.
yeah.
And now I just kind of feel like I'm, in the groove with that. Like I'm pretty, my spouse and I joke about it that, that I really like, I have a pretty good track record right now of calling my diagnoses.
Yeah. Was there anything that you were super surprised to find out wasn't normal? Because for me, it was literally everything.
Literally everything.
Yeah.
Literally everything. Well, it was pretty much divided between like, oh, that's not normal, and oh, that's not a personal failing. So it's actually really good for my self-esteem to find out I had an incurable disorder.
Right, yeah. Like there's a reason for all of this.
There's a reason nothing seems to work the way it should.
How many suggestions did you get that maybe this actually wasn't something physical and was somehow psychosomatic? Did you face that at all?
Oh yeah, I mean, the muscle spasms in my shoulders are totally my stress and not my muscles trying their hardest to hold my head on. Um and yeah, and there was a point when I was in my 20s where I was just I became extremely fatigued, and I was sleeping like 16 hours a day, or I guess 14 hours a day because I had to commute to work and back because I was still working at that point, or trying to. So I was sleeping basically like all the time I wasn't at work, and I was starting to experience pain in my hands and dizziness when I stood upright. That might sound familiar to anyone who has dysautonomia. So I went to the doctor, and they asked me all these questions about what was going on in my life. And at the time my dad was being treated for cancer, so they were like, oh, clearly this is just depression,
Yeah.
because of the stresses in your life. And, the thing is, they put me on an antidepressant and I felt better. But, selective serotonin reuptake inhibitors are sometimes used to treat dysautonomia.
Right. Because we only have so many drugs that work on the nervous system. So a lot of times, they do use antidepressants to treat pain and to treat other neurological conditions.
Oh, totally.
Yeah.
And the other thing is that, like, I'm not, I do have several anxiety disorders that were also undiagnosed at that point. And, the Lexapro made my anxiety better too.
Mm.
So, so even though like I was being treated for the wrong thing, I still felt better and was able to ignore, the brewing medical crisis for, maybe 4 more years after that.
Right. Yeah, that sounds familiar.
And then the other thing is, since it's genetic, like having poor health was actually pretty normative in my family.
Right. Yeah.
And, I never really considered myself that hypermobile.
Yeah, me neither. I had friends that were gymnasts and ballerinas and stuff who had trained for hypermobility. So compared to them, when I started reading about EDS after being diagnosed with POTS, I was like, oh, my thumb bends like that, but I don't think I'm really hypermobile.
Exactly. I never do like a perfect split. Like, never mind that, my range of motion on my head is like way beyond 180 degrees.
Yeah, a doctor recently, when he was examining my hypermobility, told me it was just about good enough to play the lead in The Exorcist. Hypermobility in my neck. And I was
amazing.
Like, oh, okay, that's fun.
Great.
Yeah.
Yeah. Well, that is fun, and that's also really relevant for Halloween time, I think.
Exactly. Yeah. Comes in handy about once a year.
Yeah. And then the other, but I want to say the other thing that was, kind of going on with my family is that, my parents were, they had grown up middle class, but their parents hadn't necessarily. They were children of the Great Depression or immigrants. So there was really kind of like a push towards self-sufficiency.
Mm-hmm.
So on one hand, it was like normal to feel terrible all the time, but on the other hand, like you really had to like push through it and succeed anyway.
Yeah. Also very familiar.
Yeah. And I mean, I love talking to other people who've had like this kind of experience of undiagnosed chronic illness and progressive disability, because it really makes me feel like it's not, it wasn't just me. There are reasons this happened. This isn't my fault. Like,
exactly.
This isn't my family's fault. Like, these are large, kind of sociological factors that are really, affecting lots of people.
Oh, for sure. I mean, that's pretty much entirely the reason that I started the show. Like, I am fascinated by this stuff, and I love to ask people really invasive questions about their health, and I am so interested in how cultural attitudes kind of shape our attitudes about health and illness and life and death and that sort of thing. And it's just been really fascinating to be able to ask people about that stuff.
Yeah. Oh, yeah. And I mean, at least for me, a huge part of coming to terms with being chronically ill and, disabled is kind of questioning those assumptions that, that we grew up, hearing, or that, people continue to make. Growing up, like, I want to be clear that, like, I was very lucky. My parents loved me. They took me to the doctor. We had the resources for that. But, they tell me, stop kvetching, stop complaining, or you're being a hypochondriac.
Mm-hmm.
Like, no, like, even though you're losing feeling in your pinkies, you're okay. Trust me, you're not having a stroke. Because that was the only reason I knew of that you could lose feeling in your hands.
Right.
No one was talking about, cervical radiculopathy to an 11-year-old.
Right.
Yeah, so there was just a lot of like, oh no, I don't want to be a hypochondriac. Better keep quiet about all these terrible things that are starting to happen with my body.
How has this all affected your relationship with your family?
So it's kind of interesting. Like, it kind of put my childhood in better perspective for my parents too, not just me. But, so one thing that happened is that, about a year after my initial EDS diagnosis, and a couple months after I first became really sick with postural orthostatic tachycardia syndrome, my dad was diagnosed with a recurrence of his cancer. So for the next half year, I spent a lot of time uh, with my family, being there for my dad, and he died that summer. But, I think that kind of having those things happen in really quick succession created this weird kind of like it was a big tangled mess of emotion.
Yeah. I was going to say vortex.
Yeah, it was a huge vortex.
Yeah.
Like I didn't actually cope with my own.
Yeah, because you have no time to process any of that stuff. Like, there's just so much going on.
Yeah, it was like, yeah, I'm dizzy, but like I'm just gonna be sleeping in this chair in the hospital room now anyway, so it's fine. And I was like actually kind of glad that I wasn't able to work,
Right.
and it actually, freed up some, a lot of time for me to be with my family.
Yeah, that's good.
But also, kind of delayed my own diagnosis just because I was, not that into my own medical stuff right then. But, that was just like a huge change for my family. Because I grew up with a very tight nuclear family, my mom, my dad, my brother, and me. And that was a huge change to the family. And I think in a lot of ways we are closer now. And I think it's been like, really good to just kind of have the truth finally. But it's hard to separate, what happened to me from what happened to my dad.
Yeah.
And I think that's also why I like kind of jumped on the opportunity to do some advocacy. It's like, my dad, was gone, and I, really didn't want to like deal with my own stuff. It's like, if I, clearly someone who's coordinating a support group has to be okay, right?
Yeah.
I'm fine. Yeah, look, I'm helping other people. I'm totally fine.
Oh.
So I think there's like kind of an element of like, just don't let me think about my own problems.
Right.
But there's like, you have to balance that, because I do need to get medical treatment, but I also need to, take a break from, thinking about that all the time.
Right.
Because there's so much more to think about than that.
Yeah.
Yeah.
Have any of your friends disappeared on you?
No one, I wouldn't say that, I wouldn't say so, but, I also had like a pretty tight group of friends beforehand. And I'd gone through some really like ridiculous medical things in my 20s that were unrelated to Ehlers-Danlos syndrome. I had a tumor removed at one point. It was benign, but it was huge, and pressing on my internal organs.
Oh, that's fun.
Yeah.
I found one in my jaw when they removed my wisdom teeth. They were like, yeah, we pulled it out. We were surprised it was there. If we didn't find it, it would have broke your jaw. I was like, oh, okay. Thanks. What were all those x-rays for then?
Yeah. Yeah. I'd gone to one gynecologist who was like, lots of people have bad periods. And then the next one was like, holy shit, you have a 10-centimeter tumor.
Oh my God.
So let's say that like the friends who'd like stuck around through that were already like the kind that were down with gross medical shit.
Yeah.
And I'm just, I have a very close friend. I've known her since college. We immediately clicked. She lives in Vermont now, but we talk on the internet all the time. The internet is, I can't imagine being sick and disabled before this. It's
unimaginable.
That must have been really isolating. But yeah, so we talk frequently, and we see each other when we can. And I'm just really lucky to have an amazing spouse who always is there to remind me that my value as a person is not my value, is not the value of my paycheck, which is not very good these days.
Right.
But, because there's a lot of internalized ableism that you have to work
Oh,
through.
for sure. For sure.
Yeah, but he's really good with like the capitalist side of things, so, like, no, you're worth so much. Yes. But yeah, like I'm just, yeah. And then I also, I live in a city. A lot of my friends are in walking distance, so I'm able to stay in touch with them. And then also, even though there are people who have lost touch with, especially because we don't really have like similar interests anymore, people who are still like traveling and going
Mm.
out things and doing things that aren't just like sleeping or activisting, my two favorite activities. Uh, but but I've made like, some really, you know, amazing new friends, who are also disabled and or chronically ill.
Nice.
Yeah, so no, the new people are great, and I still definitely have some old people in my life, but I think as you get older, your friends are always going to change.
Mm-hmm.
But it's not like there was anyone close to me who said something appalling and then disappeared from my life. And I know many people who that has happened to, so
Yeah.
I count my blessings.
Yeah, that's good.
Yeah. But no, I think I know some good folk.
Good.
My sick friends and I play a game called Try Not to Throw Up on Regional Rail, in which basically it just consists of us like texting each other like, I'm trying not to throw up on the train.
It's so funny.
Yeah, sick person humor.
Yeah,
Yeah.
that's really funny. Can you give me a snapshot of a time where someone said or did something really clueless or inconsiderate about your medical condition? All but one person has laughed at that question.
Recently I was at synagogue with my mom for Yom Kippur, and an older woman came up to me. I was wearing a cervical collar and my wrist braces and walking with a cane, and she asked me, like, "Oh, were you in an accident?" I said, "No, I have a genetic disorder." She said, "Oh, that's terrible," and she just walked away.
Thanks.
Thanks,
Thanks for
I
that.
think. But yeah, I mean, like, I have people like, pray for me on the bus, which is okay. I mean, I don't have time to like, tell them about the social model of disability before my spot, and I'll just say thank you.
Right.
Um, like, don't pray for me. Pray for like, accessible taxi cabs or.
Right. Pray
Yeah.
that people finally understand that accessibility means more than ramps.
Yes, yes. But yeah, that's that's like a pretty benign instance, but it was just so funny.
Yeah, it is funny. What do you beat yourself up for?
Mostly everything. But I'm working on that with my psychologist.
That's good.
Yeah.
Therapy is important.
Yep. Yeah, that gets me out of the house on a weekly basis at the least. Yeah, I mean, I just, I have a tendency to blame everything on myself and to compare myself to, some unattainable image of perfection. But I still have the impulse to beat myself up, but at least I can check myself now and be like, wait, realistic goals.
Yeah.
Yeah.
I always, when I find myself, engaging in negative self-talk, I
Yup.
will, I'll stop and I'll ask myself, if I were speaking to a friend of mine or a loved one, would I ever say anything like this to them? Or would I even think this about them? And the answer, unequivocally, 100% of the time is no. So then I try and stop and I'll say, like, if you wouldn't say it to somebody else, you can't say it to yourself.
Yes, that's a really good strategy.
Yeah.
I'm gonna try to do it more. I've
Yeah.
had people tell me it, but it's hard.
Yeah. Oh, I mean, I've been trying to do this for a couple years and it's still
Yeah.
not quite automatic yet.
Yeah, practice.
Yeah.
But sometimes I just think I'm positively awesome. I think go back and forth.
Yeah.
Like it's not all the time.
Well, that's good. You have a balance.
Yeah, sometimes I'm beating myself up for things. Sometimes I think I'm pretty awesome. So, I have moods.
What are the goals or priorities that you have for the management of your condition?
Right now I just need I just need someone to tell me about my neck. I need a couple opinions and I need my neck fixed or not fixed. I need to know.
Yeah.
But I mean like long term, I want to, maximize my my abilities for as long as possible, without dedicating my entire, conscious waking life to it. To me, it's all about like finding kind of that sweet spot
Mm-hmm.
where you're, I mean, I'm not in denial. Like I think about this every day. I can't not think about it. I take meds several times a day. I have to put my bones back in when I wake up.
Yeah, it's not something you can just ignore and be like,
Yeah,
I'm totally fine.
exactly. Like I did that for long enough.
Right.
Probably did a lot of damage. We
Yeah.
probably shouldn't do that anymore. But I guess my long term goal is just, finding balance and, kind of continuing to, redefine what it means to be like a contributing member of society
Mm-hmm.
when paying work is maybe not on the table anymore.
Right. Yeah.
And, just to continue to feel, like I'm doing something. And by
Yeah.
doing something, I mean fighting ableism
Yes.
in all, wherever it may be.
Yes. What advice would you give to somebody who is still undiagnosed?
Take to the internet, uh, and don't and start looking for people who have had similar experiences to you
Mm-hmm.
because. I mean, the information is out there, and I know lots of people who have, either found, what they have on the internet, or they've found, they've gotten a recommendation for a doctor who can figure things out.
Right.
Um, and then the other thing is, I would say like, you know, try to be patient. Like it might be a really long haul,
Mm.
and you don't have to wait until you're diagnosed to try to manage your condition.
Yeah. Yeah, that's good advice. Which some of it is probably the same answer to this question, which is what advice would you give somebody who was just diagnosed this morning?
Take me to the internet and find people with your condition and read all you can.
Yeah.
People say like don't read it because it's scary.
Yeah.
I like to know. I mean, if you know that you're the kind of person who doesn't like to know, I guess you shouldn't read things.
Yeah.
But really, like, I recommend, like, trying to learn as much as possible, so that you can be an informed patient and an active participant in, like, deciding what kind of care you want.
Mm-hmm.
And also, there are amazing patient communities out there who can support you and probably tell you more about your disorder than your doctor can.
Oh, for sure. Yeah.
Yeah. I guess the answer to all the questions is internet.
Yeah. All right. Well, thank you so much for talking to me.
Oh, you're welcome. Thanks for interviewing me. I hope you got some good stuff.
We did get a lot of good stuff. So much so that this is only part 1 of a 2-part interview. Part 2 will be out next Tuesday, and we get into it on disability issues and Rebecca's activism. Thank you so much for listening to In Sickness and in Health. I hope you enjoyed this episode. If you did, subscribe and stay tuned for everything that we have to come. And check out our episodes celebrating Dysautonomia Awareness Month that are up this week. We'll have a new episode up every day. You can find us at insicknesspod.com and on Twitter, Tumblr, and Instagram at InSicknessPod. Please rate and review us on iTunes. It helps other people find the show. And tell your family, tell your friends, tell your doctors. But most importantly, don't forget to be excellent to yourselves and each other.